So, good morning everyone. I am Shalu. I am here to continue the report about bipolar and related disorders. The topic outline. So, what is substance or medication induced bipolar and related disorder? Substance or medication-induced bipolar and related disorder is classified as mania, hypomania, or a major depressive episode directly caused by a substance or medication that is or has been taken. This diagnosis will be dependent on the individual's personal mental health history as well as the nature of the substance or medication taken. These changes in mood must be prominent and persistent in order to be classified as substance or medication induced. The symptoms must also start during or soon after the substance or medication was taken or during withdrawal. So next is the diagnostic criteria. A prominent and persistent disturbance in mood that predominates in the clinical picture and is characterized by abnormally elevated, expansive, or irritable mood and abnormally increased activity or energy. B. There is evidence from the history, physical examination, or laboratory findings of both 1 and 2. So 1. The symptoms in criterion A develop during or soon after substance intoxication or withdrawal or after exposure to or withdrawal from a medication. 2. The involved substance or medication is capable of producing the symptoms in criterion A. Next, C. The disturbance is not better explained by a bipolar or related disorder that is not substance or medication induced. Such evidence of an independent bipolar or related disorder could include the following. A. The symptoms precede the onset of the substance or medication use. The symptoms persist for a substantial period of time, like for example, about 1 month after the cessation of acute withdrawal or severe intoxication. Or there is other evidence suggesting the existence of an independent non-substance or medication-induced bipolar and related disorder. Like for example, a history of recurrent non-substance or medication-related episodes. D. The disturbance does not occur exclusively during the course of a delirium. E. The disturbance causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. So, note that this diagnosis should be made instead of a diagnosis of substance intoxication or substance withdrawal only when the symptoms in criterion A predominate in the clinical picture and when they are sufficiently severe to warrant the clinical attention. So this is the ICD-10-CM codes for the specific substance medication-induced bipolar and related disorders. Naka-indicate dito sa table yung mga code sa specific na substance. So note that tobacco, caffeine, inhalants, opioids, and cannabis are not listed as a substance that can cause a bipolar disorder in DSM-5-TR. So, determination of the substance of use can be made through markers in the blood or urine to corroborate or confirm the diagnosis. Prevalence. Limited epidemiological data exist regarding the prevalence of substance or medication-induced mania or bipolar disorder. Prevalence of substance-induced bipolar disorder will depend on substance availability and level of substance cost in a society. For example, if yung countries with cultural prohibitions against alcohol or other may substance use may have a lower prevalence of substance or related disorders. Comorbidity. Comorbidities are those associated with the use of illicit substances. In the case of illegal stimulants like cocaine and cat or phencyclidine, or diversion of prescribed stimulants like amphetamine and methamphetamine. Comorbidities related to steroid or immunosuppressant medications are those medical indications for these preparations. Delirium can occur before or along with manic symptoms in individuals ingesting phencyclidine or those who are prescribed steroid medications or other immunosuppressant medications. So next is bipolar and related disorder due to another medical condition. So what is it? So bipolar and related disorder due to another medical condition is a mood disorder diagnosis given when there is a prominent and persistent period of abnormally elevated, expansive or irritable mood and abnormally increased activity or energy that is attributable to another medical condition. Medical conditions commonly known to cause bipolar mania or hypomania include Cushing's disease, multiple sclerosis, stroke, and traumatic brain injuries. So in particular, for the Cushing's disease, once it is cured or in remission, the hypomania or mania typically will not recur. So the diagnostic criteria: A prominent and persistent disturbance in mood that predominates in the clinical picture and is characterized by abnormally elevated, expansive, or irritable mood and abnormally increased activity or energy. B. There is evidence from the history, physical examination, or laboratory findings that the disturbance is the direct pathophysiological consequence of another medical condition. C. The disturbance is not better explained by another mental disorder. D. The disturbance does not occur exclusively during the course of a delirium. E. The disturbance causes clinically significant distress or impairment in social, occupational, or other important areas of functioning or necessitates hospitalization to prevent harm to self or others, or there are psychotic features. So, specify if the coding note, the ICD-10-CM, yung sa kanina na pinakita ko, na code, nagadepend ito on the specifier. So, specify if with manic features, full criteria are not met for a manic or hypomanic episode. With manic or hypomanic-like episode, full criteria are met except criterion D for a manic episode or except criterion F for a hypomanic episode. So, with mixed features naman, symptoms of depression are also present but do not predominate in the clinical picture. So note that you need to include the name of the other medical condition in the name of the mental disorder. Like for example, F06.33 bipolar disorder due to hyperthyroidism with manic features. So the other medical conditions should also be coded and listed separately immediately before the bipolar and related disorder due to the medical condition. Like for example, E05.90 hyperthyroidism, semicolon, F06.33 bipolar disorder due to hyperthyroidism with manic features. So next is other specified bipolar and related disorder. So what is other specified bipolar and related disorder. This category applies to presentations in which symptoms characteristics of a bipolar and related disorder that cause clinically significant distress or impairment in social, occupational, or other important areas of functioning predominate but do not meet the full criteria for any of the disorders in the bipolar and related disorders diagnostic class. The other specified bipolar and related disorder category is used in situations in which the clinician chooses to communicate the specific reason that the presentation does not meet the criteria for any specific bipolar and related disorder. This is done by recording other specified bipolar and related disorder followed by the specific reason. Like for example, short duration of cyclothymia. Examples of presentations that can be specified using the other specified designation include the following: short duration hypomanic episodes, 2 to 3 days, and major depressive episodes. Second, hypomanic episodes with insufficient symptoms and major depressive episodes. Third, hypomanic episode without prior major depressive episodes. Fourth, short duration cyclothymia, less than 24 months. And lastly, manic episodes superimposed on a schizophreniform disorder, delusional disorder, or other specified and unspecified schizophrenia spectrum and other psychotic disorder. Next is the unspecified bipolar and related disorder. So this category applies the presentations in which symptoms characteristic of a bipolar and related disorder that cause clinically significant distress or impairment in social, occupational, or other important areas of functioning predominate but do not meet the full criteria for any of the disorders in the bipolar and related disorders diagnostic class. The unspecified bipolar and related disorder category is used in symptoms in which the clinician chooses not to specify the reason that the criteria are not met for a specific bipolar and related disorder, and includes presentations in which there is insufficient information to make a more specific diagnosis. Next is the unspecified mood disorder. So this category applies to presentations in which symptoms characteristic of a mood disorder that cause clinically significant distress or impairment in social, occupational, or other important areas of functioning predominate but do not, at the time of the evaluation, meet the full criteria for any of the disorders in either the bipolar or the depressive disorders diagnostic classes, and in which it is difficult to choose between unspecified bipolar and related disorder and unspecified depressive disorder. So, specifiers for bipolar and related disorders. So, if gusto nyong mas maintindihan, pwede nyong i-check sa DSM-5-TR. So, specify if with anxious distress, with mixed features, like manic or hypomanic episode with mixed features, depressive episodes with mixed features, rapid cycling, with melancholic features, with atypical features, with psychotic features, with catatonia, with peripartum onset, and lastly with seasonal pattern. Nandun sa DSM-5-DR yung thorough na explanations nito. So, next is the The causal factors in bipolar disorders. So many investigators believe that multiple causes acting together contribute to the development of bipolar disorders. Evidence points to cognitive deficits in people with bipolar disorder in recognizing facial cues of emotions in orders, deficiencies that appear tied to abnormalities in the workings of the brain's prefrontal cortex and limbic system. Brain imaging studies find supporting evidence of abnormalities in many regions of the brain, especially those involved in processing emotions. So, genetic factors play a major role in bipolar disorder. In a large population-based study in Finland, investigators found the concordance rate to be 7 times greater among MZ twins than DZ twins. So, MZ means monozygotic. Twins arise from a single zygote and have always been thought to inherit identical genomic sequences, whereas DZ means dizygotic twins arise from two different zygotes. Next is the neurochemical theories. So first is the biogenic amine theory. So, biogenic amine theory hypothesizes that both mood and pain regulation are mediated by bioamine systems including dopaminergic, noradrenergic, and serotonergic neurotransmitter systems. So, sa depressive episode, yung there is a deficiency of dopamine, serotonin, and norepinephrine. And sa bipolar disorder naman, there is an excessive dopamine, serotonin, and norepinephrine. So the kindling theory. This theory asserts that people who are genetically predisposed toward bipolar disorder can experience a series of stressful events, each of which lowers the threshold at which mood changes occur. Eventually, a mood episode can start and becomes recurrent by itself. Not all individuals experience subsequent mood and episodes in the absence of positive or negative life events. So next is the treatments. So electroconvulsive therapy, antidepressant, mood stabilizer, antipsychotic agents, and psychotherapy. So, electroconvulsive therapy, more commonly called shock therapy, is the idea of passing an electric current through someone's brain. So, it is generally safe and effective treatment for severe depression and shows that it can help relieve major depression even in cases in which drug treatments have failed. So next is the antidepressant drugs. The antidepressants increase the availability of certain neurotransmitters in the brain, but they do not do so in but they do so in different ways. Like for example, like ang mga antidepressant kasi may iba-iba silang parang ginagawa, like for example, the TCAs, the MAO, the SSRIs, and the SNRIs. Next is the lithium and other mood stabilizers. So it could be said that the ancient Greeks and Romans were among the first to use lithium as a form of chemotherapy. They prescribed mineral water that contained lithium for people with turbulent mood swings. So today, the drug lithium carbonate, a powdered form of the metallic element lithium, is widely used in treating bipolar disorder. So lithium helps reduce mania and stabilize moods in bipolar patients and reduces the risk of relapse. Next is the psychotherapy. So psychotherapy, there is cognitive behavior therapy, psychoeducation, interpersonal therapy, and multi-family group supports. That ends of my report. Thank you.